Welcome, 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 and thank you for spending some of your time with us. My name is Tina Rosenquist, and this is Knowledge for Wellness. And this show is to better inform you, because when you know more, you are empowered to make better decisions for yourself and your loved ones for a better quality of life. And knowledge is power. And today's topic is on prescription drug abuse. And I am delighted to present Jay Jaffe, and he is the Alcohol and Other Drug Abuse Prevention Coordinator from this Minnesota Department of Health. Welcome, Jay.
Thank you, Tina.
I'm so delighted that you could come and educate my viewers on this. This is big because I'm hearing more and more about abuse. So before we get into details on all of that, I'd really like for you to take a moment and introduce yourself and tell everyone a little bit about yourself and your background and your passion and why this line of work.
I've been working in this field for 32 years.
Okay.
16 years at the Minnesota Department of Health, and it's an ongoing problem that always seems to have lots of needs, and we think a lot of it's preventable, and so my passion is trying to stop it before it starts.
Great, and I'm so delighted that you could come on Knowledge for Wellness and educate our viewers, because that's what we're about knowledge, about prevention, and about wellness, especially when it affects a loved one.
Sure.
So that's really great. And there seems to be so much talk about this, and even more and more about people getting addicted to drugs. And I don't know exactly, what the stats are or anything like that, but for you to come and share a lot of this information. So just a little bit of information could go a long way here.
Well, I hope it's helpful.
Yeah, thank you. So my first question then is, that we are hearing so much about this. And is there any specific line or person or people that is affecting, or exactly where should we?
It's really affecting everybody. We generally think of young people, youth, and young adults.
Sure.
But there are older people, older adults who maybe unknowingly are abusing these or misusing these drugs. And so it's a problem across the board.
Wow. And so the exact problem, is there even an exact, or you're just seeing it all throughout different areas of the metropolitan area?
We're seeing it everywhere. I mean, these drugs, most of us have them in our homes, and it doesn't matter if you live in the metro area, outstate, wherever.
Okay. So where are people getting this medication from, or is it just something over the counter? Is it prescriptions, or what line does that fall into?
It's both.
Okay.
Prescription drugs are certainly a problem, but a lot of the over-the-counter products have the capacity to cause harm.
Yeah.
I mean, all these products can be very useful and very helpful when used as prescribed or as directed, but they can also be very harmful.
Yes. And now I understand that a lot of the grocery stores have to put other things behind the counter because things are happening between actually inhaling certain things. There's even over some cleaning products that they're doing as well.
Well, the main thing that's behind the counter now are the pseudoephedrine products, and that's because they were used to make methamphetamine, and that was such a big problem not too many years ago.
And I'm even hearing about the cleaners for some of your laptops, things of that nature that now are being very restricted on sales as well.
There are not laws about it, but there are certainly some merchants that are taking that responsibility, yes.
Okay. That's very good. That's very admirable of them to kind of help out on that end as well.
Yes.
We talked about prescription drugs, and so is that specifically, or how are people actually getting these drugs then?
Actually, for the most part, they're getting them from us.
Okay.
We are, according to the surveys of the people who use these drugs or use them non-medically, 70% of them are getting them from friends or family members.
Oh.
Most of them are getting them for free, some are buying them, some are stealing them. But we're the dealers in this instance, not intentionally,
Right.
but because so many of us have these products in our homes, sitting in our medicine cabinet, sitting on the kitchen counter, and people who are looking for them can find them quite readily.
Right. And I even heard that some people were replacing a certain pill by shaving off an aspirin tablet at the top and putting it back, and so even the counting of them.
Nothing would surprise me.
Yeah, I bet you've seen it all.
You've seen a lot.
Yeah, that's really. So you have a few slides that you wanted to present with us and go forth on that and educate my viewers as not only to make them aware, make them preventable, also make them preventative in that manner. And go ahead and take it away.
Okay.
Yeah.
Well, the first slides that I wanted to show you were a couple slides just showing that this is not a new problem.
Okay.
It's believed that the time after the Civil War was the time of the highest drug abuse in the United States. And if you think about all the injured people, all the displaced people, all the pain and suffering that must have been going on in this country, it probably makes sense that a lot of people were looking to medicate the pain and the misery. And there were a lot of patent medicines, and they were totally unregulated. And so there was Dr. So-and-so's remedy that would cure whooping cough and diarrhea and constipation and everything else you could imagine. And many of them had opiates in them. They may have had alcohol, marijuana resins, cocaine, any number of things. And so this first slide, this is a Coca-Cola ad from pre-1904.
Sure.
And I say pre-1904 because in 1904, the forerunner of the Food and Drug Administration was developed in this country to start regulating these substances. But prior to that, it was you could buy anything you wanted just about anywhere. And so this Coca-Cola ad, if you look at it, you see what they're selling is a little bit different than the product that we see today. It's the ideal brain tonic. They're clearly selling a stimulant. In this case, it was cocaine.
Yes, there was
which
actually
is why-
cocaine in the Coke.
Right, that's why they called it Coca-Cola.
Yes.
The Bayer Company, which makes Bayer aspirin, invented heroin in the 19th century. And in this 1901 ad that you see now, they were selling a cough suppressant. It didn't work out, needless to say. And then the last one I just wanted to show you, this is from 1885, and you see these little children building like a little cabin, a log cabin or something like Lincoln logs almost, and they've been taking cocaine toothache drops, according to the message there. And so there was a whole different mindset in this country about these products, and in 1904 we started regulating them and trying to control the problem. So it's not a new problem, it's an ongoing problem, and it continued after 1904 and it continues today.
Yes, wow. And I know that the pharmacists are also trying to do certain things and being a little bit more preventative as well. And I know there's certain prescriptions that cannot actually be called in over the phone. You actually have to take a written one to the pharmacist as well.
There are some substances, the federal government and the state have schedules based on the potential for abuse of the drugs, and the Schedule II substances in particular, you can't refill automatically and you can't call in. You have to get a new prescription and bring it in.
Yeah, you actually have to go and see the doctor again to get that prescribed to you as well, yes.
Correct.
Because they are trying to do what they can with their hands tied as well on these things. But now the big problem, what is that you see is one of the bigger problems, you know, about alcohol, marijuana, and other illicit drugs. What do you see as your profession?
We see everything. I mean, alcohol is the #1 drug of choice in this country. More people use it than anything else. Tobacco's next, marijuana's next, but then prescription drugs come after that, and they've been increasing. Since the 1990s, we've seen a really significant increase in the non-medical use or the abuse of prescription drugs. And some of that has to do with the fact that if we look at this slide, there are only 2 industrialized nations in the world that allow direct consumer advertising of prescription drugs, the U.S. and New Zealand.
Okay.
And in the U.S. it just started in 1996, so it's a relatively new phenomena. Prior to that, we didn't have that direct advertising, but today you watch the nightly news on the networks or you watch primetime television and you see all these ads for all these products, and people are going to the doctor and they're asking for a prescription for a drug that they don't know what it does, they don't know if they have the problem, but they've been sold the idea that they need that product.
Because it made the person on the commercial so much better.
Right.
Exactly.
Right, so we've seen a real increased demand, and we've also seen a great increase in the number of prescriptions written.
Yes.
So more people are using them, and as a result, there are more sitting in our medicine cabinets, sitting on our counters, and that makes them more accessible to people that are searching them out to get high. And we know that the more people that are using it, the more problems we're going to have, the more tragedies that occur, the more individual problems that people experience. And so it just makes sense.
Yes. And even some people are having allergic reactions to certain things as well. So they have to quit taking that drug. And once that drug is not reacting to their body the way they want to, they quit taking it. And what do you do with the other 25 pills?
Well, and that's become a huge problem. And traditionally, we flushed them down the toilet.
Yes.
And we know now that that's not okay.
No, because now it's getting into our water lines.
It's getting into the water. We don't know if that's why we have deformed frogs at the rates that we do. We know that we're getting trace amounts of many of these substances in our drinking water. And so we're getting smarter finally about having take-back programs, having ways to dispose of these things, whether it's the situation you mentioned where somebody is no longer getting the benefit from it, whether they no longer need it, and maybe they had surgery and the pain is gone so they don't need it, or maybe it's an expired prescription. And so we've seen more and more take-back programs in our communities where they're being disposed of properly and not getting into the groundwater, and also not getting into the hands of people that shouldn't be getting a hold of them.
Yes, exactly. And even my brother, who had an accident with his eye, and that drug didn't work, but he already had paid the copay. But because that wasn't working to the potential that the doctor wanted it to, then they asked him to take another drug and another drug. He had 8 capsules of medicine that he was unable to use any longer. And that in itself, it's not only wasteful, but what do you do with them?
Right. And you can't return them.
No, you cannot. So,
Although we're seeing some of the pharmacies are starting to set up a system where you can actually mail back some of these drugs, not the more harmful, the opioid painkillers that are really high potential for abuse, but some of the other ones. So we're starting to see some change in that.
Okay, well that's good to hear. Yes.
Yes.